Hi, my name is Sahian. I'm a PrEP Navigator here at Drew Cares. Something I do every single day. So my job basically is to navigate and help support patients in the system. If anyone is interested in PrEP, the medication that prevents HIV, I connect them to a provider. I remind them of their appointments, and I just make the process of, getting PrEP easier. So that's pretty much what I do on a day-to-day basis. So I was interested in being a PrEP navigator because I studied public health. So I was aware of the epidemic of HIV that affected all people, but mostly queer people. And as a queer person myself, I dedicated my life to making sure that marginalized communities get access and care that they need. So when I saw that Drew Cares was hiring for a PrEP navigator, I was like, I'm perfect for this role. And I was right, because I really, really love my job and helping the people that I do. Yeah, I do realize because sexual health and just like talking about sex. Okay. So sexual health is very stigmatized. I mean, sex in general is very stigmatized, very taboo. And so I do work with people from all age groups. So I have younger people and older people. And I've noticed that when it comes to the older population, there's a lot of shame and guilt surrounding sex. So what I try to tell people is that, sex is normal. People have sex all the time, nothing to be ashamed about. And as long as you are putting yourself first in your sex life and you feel safe, I think that's the most important. So I just try to remind people that there's nothing wrong with being a sexual being, but the most important part of my job is making sure that if you're having sex, that you're doing it in a way that feels good to you, you feel safe, and I guess thinking about your health in the long term as well. I am Latina, I'm Mexican, my parents are immigrants, and as a radical feminist, I see that machismo spills itself into every aspect of your life. And I think when it comes to sexual health specifically, a lot of men think that what being a man or being masculine is being the sexual person, having a lot of sexual partners. But in my opinion, what I've noticed with a lot of the men that I have as patients, what I've noticed in some of the men, especially the Latino men that I talk to, I've noticed that a lot of the time when it comes to the queer men, they're a little bit more open with their sexuality and their sex life. But when it comes to straight Latino men, they're a little bit more hesitant and they're a little bit more reserved when it comes to talking about sex, especially I think because I'm a woman. So I try to just remind them that your identity as a man, it doesn't have to do with your sexuality, like how much sex or how much little sex you have. I think the most important thing is making sure that I create a safe space for people to be able to express their emotions without feeling judged. Because also, in today's culture, we shame men for having emotions, or we shame men for even being sensitive. But I try to create a space where men feel empowered to talk about their emotions and doesn't make them weaker, but actually makes you stronger to be emotionally intelligent. So yeah. Oh my god. This question, I'm like, I knew that this is my question. So let me try not to get too political, even though it's important. So a lot of what we do, because we are a grant-funded department, a lot of what we do is funded by the federal government. And right now with the administration and our funding getting cut, a lot of our services are being put to a halt, or people are getting their pay cut, getting their hours cut. And all I want to say, and what I wish the administration would know, is that your health is one of the most important things that you could ever have. Having a health is a human right, and in cutting these fundings for prevention, not only is infringing upon people's rights, but it's also infringing upon, people's, I don't even know how to get into this. Everything about it is just bothering me, and I really hope that people that were making these laws could know how people's lives get affected. They are so out of touch with reality because they don't spend a day-to-day working with our patients. So I wish they could just see how important our work is every single day and how many lives our work actually changes. And I feel like they would probably change their mind, or I hope they would have enough empathy to actually change their mind and put money where it's actually important, which is people's lives and not for profit and not for corporations. Okay, do I go?
Yeah.
Okay. So what I want to see sexual health be redefined as in the Latino community is, I think instead of focusing on shame, because there's a lot of shame, especially towards women revolving around sex, I want to see more empowerment, and I want to see more focus on pleasure. A lot of the time, the conversations that I have seen in Latino communities, within women specifically, is about just ways that they can be, that we feel like personal pleasure, and not really on trying to perform or entertain the other person that you're having sex with. And Yeah, I think the conversation around sexual health is very scientific and biological, but we forget the social aspect of sex as well, like pleasure. So.